Okay, so it's 11:30, so I think we can get started. So welcome everyone to this month's Security Health Plan Academy webinar. Our focus today is preparing for a provider visit. Before we get started, just want to remind you all to please keep your video off and mute yourself. At the end of the presentation, we will take questions. You can submit those questions through the chat feature here in Zoom. If we don't get to your questions, please don't worry. We will still address it and send a response to you in a follow-up email before the end of this month. That follow-up email will also include a link to the recording of today's presentation, as well as links to different helpful resources on this topic of preparing for a provider visit. So without further ado, it's my pleasure to introduce Carrie Murray. Carrie is a nurse care manager here at Security Health Plan. So with that, Carrie, I'll turn it over to you.
Great, thank you. Good morning, everyone. Soon to be afternoon. My name is Carrie. I'm a nurse care manager here at Security Health Plan. As Kristen had mentioned, I'm going to go ahead and talk today about preparing for a provider visit. At Security Health, our mission, vision, and value centers on members and the communities that we live in to learn, work, and grow our best health. We enrich lives and we will continue to innovate for generations to come. As you can see, our values here centered and focused around members, trust, teamwork, excellence, and affordability. I always like to quickly provide any conflicts of interest. My disclosure only today is that I would rather be on Rib Mountain on a chairlift with my family than what blustery, cold, icy winter storms we're experiencing right now. So there you see a picture of us just in October this year. I'm sharing with you guys, but I would say today is truly majestic looking. So pretty nice outside. Today's objectives, I will discuss the importance of visiting your primary care provider regularly based on clinical recommendations, define the significance of a patient-provider relationship, describe self-advocacy, and review some vital steps you can take to ensure a positive and meaningful experience between you and your health team. So a little bit about myself. I am a nurse care manager here and I work in the health services department. As a care manager, we provide quite a wealth of information to individuals dependent on their specific health needs. I focus on patients who have chronic health issues, conditions that would be maybe more complex in nature and have specific care needs that I can better assist with. Care managers are able to assist with coordinating services, connecting with community resources, helping with any kind of medical needs, education of sorts related to maybe medication adherence, helping with nutrition, lifestyle changes, increasing your overall well-being. And we're certainly able to help create a care plan for you that best prioritizes your needs and find solutions for your concerns that you may have. My nursing career goes back a little over 18 years. I've worked in a variety of clinical settings, started in the hospital, transitioned over to clinic, worked in home health as well as hospice care. I hold both a Bachelor's of Science in Nursing as well as a Master's. And I also am adult health clinical nurse specialist board certified with a specialty in chronic care management. I'd first like to talk a bit about primary care health services specifically. So what does primary care mean? Primary care services really encompasses a wide variety of care choices. It's partially related to health prevention, promotion of your health and wellness, overall maintenance and education for your health needs, and also assisting in that diagnosis and treatment of any acute or chronic illnesses. Studies have shown that patients receiving primary care services overall have had better health outcomes. Building a strong, ongoing, trusting provider-patient relationship is important. This truly allows you to open up and share any personal concerns you may have with your provider team. Being prepared for an upcoming provider visit helps you to proactively plan for a successful interaction with you and your provider team. So your primary care provider is essentially your medical captain to your health journey. I look at it as such as that individual is really the hub of a principal point of care for you. There are different types of providers. There are MDs, which stands for medical doctor. There are DOs, which stands for Doctor of Osteopathic Medicine. PAs, who are physician assistants, and NPs, nurse practitioners. There are two main specialties within primary care. They are family practice and internal medicine. Family practice essentially focuses on the delivery of comprehensive care for individuals of all ages, newborns to seniors. Internal medicine providers essentially focus on more of the needs related to your healthcare across the care spectrum for any other complex health needs throughout your life. Visiting your primary care provider regularly is highly encouraged, and it certainly is a great way to stay healthy and stay informed. So what are some of those steps you can take for a successful primary care provider visit? Some of these may sound or seem pretty simple, just kind of a review of some, but first of all, be on time for your appointments. It's real important to make sure that you are present and ready for that appointment. Being said, when on time, it should be at least 10 minutes before that you are there for your appointment. That allows you to check in, get any kind of information to the administrator there for anything related to insurance, insurance cards, and IDs to present to them if requested. Making sure that you prioritize top concerns that you want to discuss with your provider ahead of time is important. I would ask, if easier for you, bring it along on a notepad, write them down ahead of time. It will help you gather your thoughts during your visit with your provider and also allow you to take notes during the visit. Being as most specific and descriptive as possible about what some of your health needs are will be helpful for that provider. Additional steps would be, if able, take a loved one with you to your appointment. So whether that be a neighbor, a friend, a family member, they're the extra eyes and ears for you. So maybe there's something that you're focusing on for that visit and you really kind of hone in on that. And after the visit's done, you're able to talk through it with that individual who was able to attend with you. It helps really kind of bring that information together so that there wasn't any information perhaps that would be missed or forgotten during that visit. Reviewing your current medications is very important. So if you are seeing multiple providers, there may be different prescriptions that you have that your primary care provider may not be aware of. It would be important to make them aware of what those medications are that you're currently taking. So if you're able to bring a current medication list with you to the appointment, would be great. Another example would be to bring in the current medication bottles that you've been prescribed. And then the care team can go through with you those medications at the time of that visit to verify and to ensure that you are taking the medications that you are needing to appropriately. Remember that medications, along with the prescribed ones, also include any over-the-counters as well as any supplements. So being open and honest with your provider is always a recommendation that I encourage folks to do, whether it be you're sharing about your physical activity, if you've had any recent falls lately, or maybe some increased weakness, how your nutrition is doing. Perhaps you're concerned about something related more to your memory, or if you're having some depression-like symptoms. Those are all important variables to share with your provider during that visit. So when you're talking to your provider and there's discussion about how you've been doing, there's a physical exam taking place, it's real important to make sure that you share any kind of medical changes that would have occurred since your last visit. So have you had any kind of procedures, any kind of outpatient surgery? Were there any other medication changes from different providers? If perhaps you're seeing other providers, specialties, or therapists, include that in your conversation. Important to also find out what's the best way to communicate with your provider. So most offices have their direct office line that you're able to contact and relay messages to. There's also recent with the electronic communication means that we have throughout the nation of what we call a web patient portals. We have My Marshfield Clinic as an example, where you could send in non-urgent communication directly to your patient care team, to your provider regarding any concerns that you may have. And if you do have any kind of health or fitness trackers that you utilize at home, perhaps they may be more of like a log that you're tracking in a notebook, blood sugars, if you're testing your blood pressure, if you're tracking any kind of symptoms that you might be having, those are all important to bring along with you to your visit. So coming to the end of the provider visit, it's always important to discuss those clinical findings that the provider had noted during the visit and to discuss what recommendations they have moving forward. Those recommendations could be perhaps follow-up lab work, maybe a referral being placed somewhere, and were there any kind of medication changes? And if so, make sure that you verbalize that and understand clearly. Taking notes, even at that time of when there's a summary that's being given to you, there's an after visit summary that's usually printed out at the end of a visit. It'll have like your height and weight, blood pressure, and diagnosis, any follow-up recommendations. I would truly encourage you to utilize that same content and mark down any kind of notes or suggestions that you have from the provider to consider moving forward in that review of care plan. So one thing that I highly encourage all patients to do and be when they are with their care team is be your own best advocate. That is self-advocacy, speaking up for yourself, making sure that you're asking the right questions and clarify anything that you're not sure about. Building that rapport, building that trust with your providers is key. When you gather all that health information, you can make your best informed decisions based on those recommendations by your provider. And that can be with your own, encouragement of family and your morals and values based on what that consideration is. Clearly and openly communicating with your provider allows for a bi-directional collaborative conversation you can have with the care team, staying open, not feeling embarrassed about something that you maybe were holding back on or you weren't sure how to ask. Just know that there's no embarrassing question. It's important to bring those forward to your provider. Another point that I'd like to bring up, always within a clinic visits, it's important for individuals to know that they are having their voice heard in a way where they have their advanced care planning completed. So advanced care plans are directives or documents in a way that outlines the wishes of yours in the event that you're unable to speak for yourself. If you have completed those documents, make sure that those copies are on file with your provider and with the hospital or hospitals in which you would be nearby, so that at the point in time, if there was any kind of illness or crisis that brought you to that state, then at least they would have that document available to reference and refer to. Important to make your wishes known prior to there being a crisis or illness state. I have here a video link that's going to be shared with you afterwards in the follow-up email. The audio wasn't working for us yesterday when we tried it, so I'm not going to be able to play it for you today, but it is just a couple minutes talking further about our Honoring Choices initiative here in Wisconsin. And really it speaks to having the conversation with your loved ones and identifying an agent or agents who you would have speak on your behalf if you were unable to do that for yourself. I wanted to make you aware also of our Patient Navigator program that we have partnered with Marshfield Clinic and Security Health Plan. The Patient Navigator team is able to assist any of you with identifying primary care providers, help schedule appointments, answer any billing questions, and even discuss coverage and benefits for you. They are available Monday through Friday. I have the number listed there for you to reference. And there's also an email that you can send if you have questions that they would be able to assist you with. So in wrap up, I just kind of wanted to give some key takeaways from my discussion and then open it up to any questions. I here put what I consider an abbreviation for PCP. So I talked today about primary care provider, and PCP takeaways would be prepare for your provider visits. Ensure that you have all the information readily available to you to bring with and discuss with your provider. The C in PCP is communicate. Communicate clearly with your provider care team. Communication is key between you and them and ensuring a strong future together and your health. And the P in PCP would be plan for further follow-ups. So what does that plan look like? Make sure that it's timely and that it's appropriate to your specific care needs. I have some references here, along with opening up now for any questions.
Yes, if anyone has any questions, go ahead and type them into the chat and Carrie can answer those for us. But to get us started, Carrie, we did have a couple of questions come in via email. The first one is there a list of questions somewhere that we can follow or print on what to ask our providers? Sometimes I feel like they really don't know me.
Certainly. So what I would first encourage, most important, is to say that, building that trusting patient-provider relationship begins with you and your provider, sharing a bit about each other. You get to know them and they get to know you. You'd also want to make sure that you're sharing about past medical histories, surgeries, procedures, any kind of family history or history that's related to your current health needs. As long as you're sharing the information about your medical history, you'll want to discuss your current list of medications and things like that. I think to get it more on a personal level, you're opening up to them and sharing. You might want to include what some of your hobbies are. And if you have any kind of pets or physical activities that you're involved in, and who truly is your support team. We do also have a pamphlet available that I believe Kristen will hand out on the email to you as an attachment to discuss further some of those other suggestions.
Yes, thank you. And then another one that came in via email was, should you be notifying a doctor ahead of time of any health issues when a wellness visit is planned, such as a sore knee or back pain? And if so, how do you notify them?
So particularly with an annual Medicare wellness visit, those do not necessarily include physical exams. It's more of routine assessments related to height, weight, and blood pressure. Also will do risk assessments and completes some of your preventative services during those visits, focusing on a care plan that would be developed for you and the provider as to what's the best plan moving forward for your health. My recommendation would be to place a phone call to the clinic prior to the wellness visit, making them aware of your concern of that sore knee or back pain. It's always important to ask what's the best way to communicate with the provider. There is that electronic communication web portal option that I spoke to in my presentation today. My Marshfield Clinic is an example. You may also need to schedule a separate visit, perhaps with your provider, to further discuss concerns that you're having about your knee or back.
Okay, here's one for you, Carrie. Is it okay to switch providers if the one you have doesn't feel like a good fit?
Absolutely. So as we talk about, I speak of relationship, and I think I liken it to relationships that you have with other friends, relationships that you have with other colleagues, and perhaps even in your own home life. The relationship with your provider and yourself should be a strong together feeling relationship, that the doctor or provider is listening to you, and that you in return are feeling like they are supporting you in what your health needs are. We have here at Security Health Plan directory of provider listings. I know there are some areas that are having difficulties of getting patients in if they are new to establish. But I would please encourage anybody that if you don't feel like it's a good fit for you and your provider, to talk to some of your friends, talk to some of your other neighbors and that, and find out, who do they like? Who have they been seeing? Is there someone that seems like it might be a better fit? And reach out to that clinic and find out if they are accepting new patients.
Thank you. Did anyone else have any questions? If not, we can get back to shoveling ourselves out of our houses here today. Oh, here's one more. If you see a few specialists who manages your overall condition?
Well, great question, actually. When I spoke of ahead of time about the primary care provider being the captain of the ship, I really state that they are the ones that hone in on all those other needs. So primary care provider is honing in on those full management. Your specialists are going to be the ones that are going to be providing those additional recommendations that all needs to go, communication wise back to that primary care provider and be inclusive of that care plan that's been developed for you.
All right. Any other questions?
I'd say, did that help answer, or does anybody have some follow-up questions to that?
And if you're comfortable, you can unmute yourself and verbally ask the question too. If you don't want to put it in the chat, that's completely okay. All right. Last call.
All right. Well, I'd like to thank everyone for their time. If you do have any other questions, please feel free to send them over, and I'd be happy to help answer them or get others to assist in the answers.
Yes, and we will send all of the questions and their answers in the follow-up email, along with all of the links Carrie mentioned and some other helpful resources. And that email will also include the link to the recording from today's presentation. So again, thank you for joining us. We hope you found this informative. And thank you very much, Carrie, for presenting for us today. And everyone, stay healthy.
Thanks, everyone.